Hoy tenemos un invitado muy especial aquí en Pachanga Latina que viene a instruirnos sobre un tema que nos gusta y nos encanta a todos. En el día de hoy nos vienen a hablar de dermatología en general, cómo mantener tu piel sana y cómo cuidar tu piel. Y con nosotros se encuentra en el día de hoy el doctor Khalil Katri. Bienvenido, welcome to Pachanga Latina.
Thank you so much. It's a pleasure. Thank you so much.
And we have you here for something that we all want to know, algo que todos queremos saber. What is it that you do that is so special for women? Let's start there. Vamos a comenzar ahí.
Well, we do lots of things, especially a lot of women. The whole society, whole world wants women to look beautiful. Women themselves and everybody who interacts with women, we all want them to look good. And the scale of beauty in different cultures is different. And I have a lot of Latina patients. They want the skin to look good, no spots on the face, no manchas. They also want to look young. We don't want any bad acne scars. We don't want the loose skin hanging, wrinkles, big belly, fat, cellulite, varices. We do all of those things to make sure that our colleagues or female patients, they look beautiful and young forever.
Do you think that when a woman goes to you, is it more, or do you consider it more to be more medical or more cosmetic? Cuando las mujeres van a verlo a usted, ¿piensa usted que es más médico o más cosmético sus arreglos?
We do both. We do medical dermatology and cosmetic dermatology. So we have a lot of patients who come for acne, rash. We treat a lot of skin cancers. We do big surgeries to fix skin cancers as well, but we also do the cosmetic work. And I have 3 different clinics, 2 in Massachusetts, 1 in New Hampshire. And between the 3 offices, we have about 30 different lasers and devices that we use. We do many cosmetic surgical procedures as well. So it depends what the patient comes in for. If the patient comes in and says, well, I have these lines on my forehead, what should I do? That's a different patient. Then a patient comes and I have this mole, it's been bleeding for 3 months, it's not healing. It's a different kind of patient. But we encompass everything and we treat everything.
And you try to personalize each patient individually.
Of course, yes.
When you mention laser, I know you've done some research with laser. Can you tell us a little bit about that? ¿Nos puedes explicar un poquito sobre el láser?
Sure. My interest in lasers and lasers research started when I was at Harvard. I did 2 years of training just on lasers. For 2 years, I didn't do anything else, just lasers. And we did a lot of research work there. Several new lasers developed from that research. I had a couple of patents on different laser technologies. And I continued that in my private practice. So we also do, still these days too, we do research work with lasers to develop new lasers and also use old lasers for new purposes.
Excellent. I know our beautiful Vanessa, who keeps herself very young, probably has some questions.
Of course. One more time, it's a pleasure to have you here, of course.
Thank you.
We know that you have 3 different places. I want to know, and I want that you explain to all the people where are the places located in all the treatments that you have over there.
Yeah, we have 3 places currently. The closest to Boston is in Revere, Massachusetts. Then we have one in Chelmsford, close to Lowell, Massachusetts. And then we have one in Nashua, New Hampshire. So most procedures we do in all 3 offices, but our main office is in New Hampshire. So there are some procedures that we do in Revere, some we do in Chelmsford, some in Nashua. But most important procedures we do all over. Like when we do Botox, fillers, leg vein varices treatment, manchas treatment, that can be done in any office. And also skin care, chemical peelings, that can be done anywhere. But there's a major surgical procedures, then we do in Nashua. But we're still in Revere, like if somebody just wants eyelid surgery done, we also do labioplasty that could be done in Revere as well. So depending upon what procedure is. most of the patients, because we have 3 locations, we can pretty much manage any procedure, any office. But there are times when we ask the patients to come to Nashua to do that. Or sometimes we bring the Nashua patients to Revere because the machine is in Revere.
Okay, what about for all the people who speak Spanish? How are you going to do? Because you know that we have many people who is watching us right now and they don't speak English at all. How do you do?
Me no habla. I don't speak
You can
any
try.
Yeah, just un poquito, few words. That's it. No, I always had Latino staff, Spanish-speaking staff, and also Portuguese-speaking staff, and so it's very easy to communicate. When they call, I always have someone Spanish-speaking to talk on the phone. When they come for a visit or for procedure, we always have someone Spanish-speaking. So it's very kind of in an atmosphere that they feel home, and we feel comfortable working with them too.
Do you have a certain age population that you consider is the most that are attracted to do cosmetic surgery? Let's say a person like me. She's young. She doesn't need anything.
I need some treatment. Of course I need.
But for people like me who are Latinas, who, as you know, are women who care a lot about their looks, and I say, you know, I want a little treatment here for a wrinkle here and a wrinkle there. Do you have like that free consultation where they can go in and you can advise them on what they need to do to their skin to look better?
There are two kind of patients that we see. One, they will come and tell us, I have this problem. How can you help me to fix it? And there are other patients that come and say, well, what can you do for me? Look at my face, look at me, and what do you think I need? And then I go over different things. We always have free consultation, so they don't have to pay for the consultation. And anyone who comes, we always ask them to come without makeup, so we can see.
That's hard.
I know.
That's really hard.
I can't do it that way.
I know.
I can't.
Or bring your makeup with you, so we can take a look at the skin without makeup, and then you can put your makeup back on. But I think it's because our consultation is free, we love for patients to come in. If they don't do anything, they don't do anything. If they don't need anything, I just tell them, I don't think you need anything.
In terms of, I'm going to say, because I think this is very important, because we can talk about how good we want to look. Now, when it comes to the money, that might be a setback for a lot of people that say, oh, wow, I cannot spend thousands of dollars looking good. Do you guys have any type of payment plan or any financing for women who want to do procedures that cost a lot of money?
Yes, we do. It's called care credit. So if you qualify, you pay them, you don't pay us. They will pay us whatever the fee is, and then you pay them monthly, and there's no interest on that.
Ya ustedes oyeron. I need to translate that.
Sure, no problem.
Ahí
Lo más
está
importante.
lo que le llaman el care credit,
Claro que sí.
usted puede pagar cualquier arreglito, una arruguita, una jaladita aquí, una cosita allí, y lo puede pagar en plazos, ¿verdad?
Claro que
Así
sí.
que ya usted sabe, puede
Y a
aplicar.
muy bajo interés, que es lo importante.
Ah, bueno, pues vamos
Es
todas
muy
a vernos
interesante,
bellas.
así que invitadas todos ustedes y todos ustedes, claro que sí, a que vayan a la clínica del doctor porque es muy bueno. 100% recomendado.
Well, some last words for your Latino patients who are watching our show right now. What do you have to say to them? I know it's very important for women, but there's also men, as you...
Of course.
Do you have male
Yes,
patients?
we do. We have male patients. New procedure that we have started doing in the first couple of years or so was called PRP, for hair loss. That
I'm going to send my production.
There you go.
Yes.
We take patients' blood, process it, and inject it in the scalp, which makes the hair to
Interesting.
regrow. We use this for men and women as well, and we have several Latino male patients that are doing that, and are very happy with the procedure too.
Well,
Samira, I think we have one more question, the most
Sure.
important. And what is your schedule? Like, in how many days can we find you in all the places? Because
Sure.
you know, we know that you are a really busy person, so it's important to
Sure.
let
Yeah.
them know.
No, on Monday and Wednesdays, I'm in Revere, and some Saturday mornings. So patients who cannot come during the weekdays, they can come Saturday morning. And then Tuesday and Thursday, I'm in New Hampshire, and Friday in Chelmsford. And the good thing about our scheduling is that if someone calls and said, I'm going back to Mexico in 1 week, I want to look before I go, but everywhere I call, they tell me come in 3 months.
Right.
We try to accommodate those patients, see them as soon as possible, and try to do as much as we can. So when they go home, they look this gringo is coming from America, he must look good. Or she must look good.
So, Vanessa, I think we should take a trip there tomorrow.
Yeah, we need to go there.
All right. So I want you to tell the camera and our audience your locations, times, and phone numbers to contact, to call, and make their first consultation to see you.
Sure. We are in Revere. We are on Ocean Avenue, 376 Ocean Avenue, 617-381-1717. And Chelmsford and Lowell is 978-453-5559. And Nashua, New Hampshire, 603-886-5506. And our website is www.iskinlaseronline.com. So you can go to our website. There are lots of before and after photos, all the details about the procedures that you can learn about. You can actually translate our entire website into Spanish or in Portuguese. You can read in English. We also have a Facebook page that you can go on to, Iskin and Laser Surgery Center of New England, and learn a lot of things about that. You can email us through the website. You can call our office. As I said, I have Spanish, Portuguese, English-speaking staff. Everybody's very friendly. We love to see you. Come as soon as you can.
Bueno, ya ustedes saben, el doctor Khalil Katri de Skin and Laser Surgery of New England en Boston y New Hampshire. Así que a darse sus toquecitos because summertime is here.
Claro que sí,
and we
tenemos el
must
verano que
look
viene.
good. I'm taking a trip over there. What do you think?
We should go together, of course.
Thank
You're
you
welcome.
so much for
You're
being
welcome.
with us today.
Thank
you.
And we will be visiting you. Ya ustedes saben, mi gente, a visitar al doctor para hacerse ese cuerpazo y esa cara para este verano. Thank you for being with us and we hope to see you soon.
Thank you.
Seguimos con mucho más de su programa Pachanga Latina.